So, what are birth alerts? So, birth alerts are also known as hospital alerts, and they involve sharing personal information between social workers and healthcare workers about an expectant parent that they consider may pose risk to the unborn baby without the parent's consent. Social workers flag expectant parents to hospital staff when they believe the expectant parent poses a risk to the baby, and in turn, hospital staff can flag the expectant parents to a social worker if they also have concerns about a risk to the baby. So, how exactly do birth alerts work? Birth alerts were a part of MCFD policy, and a social worker would send a birth alert to the hospital, and then the maternity ward would notify MCFD when the expectant parent was in labor or when the baby was born, so that a social worker could go to the hospital and assess the risk with the potential of apprehending a newborn baby from the parents from the hospital. How do birth alerts act as a service to people? They don't really. So often they're uncalled for with little evidence that there is a risk involved. In 2018, 28% of birth alerts in BC resulted in a child being apprehended, meaning 72% of birth alerts that a social worker tended to assess whether the parents were fit to care for their child was unnecessary. So statistical evidence showed us that no action was taken for nearly 3/4 of birth alerts calls. So how do we decide a birth alert is needed, and how do we determine who is at risk? So birth alerts are often based on assumptions that there is a cause for concern and a potential risk to a newborn baby if they stay in parental care. Common assumptions that result in a birth alert being issued are that the parent is unable to care for their child adequately based on their personal history, which can include instances of poverty, domestic violence, substance use, criminal behavior, if they have other children that have been in care, or if the parent was involved with the child welfare themselves at one point, meaning that they could have been a foster child or a youth in care. So some of those reasons admittedly may pose a legitimate cause for concern, but is apprehending a child from their life giver within hours or days of being born without notice an appropriate response? Birth alerts have been a long-standing practice in Canada. However, it isn't clear as to how long birth alerts have been being used in each province. From what I found, Quebec has been using them since 2009, but in a 2019 statement issued by Katrine Conroy, who is the Minister of Children and Family Development here in BC, she said that birth alerts had been in practice for decades. So it's unclear how long each province has used birth alerts, but it's more problematic that birth alerts are still being used in some provinces. So who's involved? As I mentioned, social workers and healthcare workers work together to issue birth alerts for expectant parents that they deem to be at risk. Most provinces have now ended birth alerts. However, Quebec, Nova Scotia, Newfoundland and Labrador, as well as New Brunswick, still use birth alerts to this day. I will say the practice of birth alerts are currently under review in those provinces at the time of this presentation. So how are they harmful and who do they hurt? Unsurprisingly, Indigenous families have disproportionately been affected by the birth alert system. While I'm sure we all know this, I would like to reiterate that the Indigenous population in BC is just about 5.9%. And in 2018, MCFD reported that 58% of birth alerts that were issued involved Indigenous peoples. So the overuse of birth alerts toward Indigenous peoples implies that the state does not trust Indigenous people to raise their children. The apprehension of a baby directly from the hospital is beyond inhumane, to put it nicely. Even if an apprehension of a baby is deemed unnecessary, the harm and trauma that it inflicts on parents is everlasting. Birth alerts reaffirm the lack of trust in the system that many Indigenous people feel, which creates barriers for Indigenous people to access care when they actually need it. The systemic racism impedes a parent's ability or desire to seek out help due to fear of losing their child to the child welfare system. So marginalized groups and the most vulnerable people in society have been affected by birth alerts more than anyone, including Black, Indigenous, people of color, Canadians that are low income, transient, and those affected by substance use and mental health concerns. So here is an infographic detailing the timeline of birth alerts in BC. So birth alerts were found to be illegal and unconstitutional by BC's Ministry of the Attorney General, according to government records originally obtained by Indigenews, which I will provide a link to if anyone is interested in reading some of the official reports surrounding this issue. So as it stands, some Canadian jurisdictions, including BC, have put a stop to these alerts, and as I had mentioned, some other parts of Canada are still using birth alerts. One of the greatest flaws within our child welfare system is the overrepresentation of Indigenous children in care. Katrine Conroy, our Minister of Children and Family Development, reaffirms this fact when she stated that about 65% of the 6,365 children in the ministry's care are Indigenous, mostly First Nations. In the final report of the National Inquiry into Missing and Murdered Indigenous Women and Girls, there was a call to action set forth that called upon the provincial and territorial governments as well as child welfare services for an immediate end to the practice of targeting and apprehending infants from Indigenous life givers after they give birth, which also said, end the apprehension of Indigenous children due to poverty or Eurocentric ideas of neglect that stem from a legacy of colonization. Poverty must not be conflated with neglect or mistreatment, and removing children from their families exasperates cycles of trauma and poverty. Which also said, immediately disallow apprehensions of Indigenous babies at birth and while they are still breastfeeding. Following the statement by the Ministry of the Attorney General that deemed birth alerts to be illegal and unconstitutional, along with the call to action in the final report of the National Inquiry into Murdered Missing Indigenous Women and Girls to end this practice immediately, it has taken some time for provinces to consider and follow those recommendations that were made 3 years ago. So BC and Alberta ended birth alerts late 2019. The territories also ended this practice in 2019 and made note that the last time a child was apprehended after a birth alert was in 2017. Manitoba eliminated birth alerts in July 2020. Ontario ended them in October 2020. Prince Edward Island committed to fully banning birth alerts by the end of January 2021. And Saskatchewan just ended birth alerts as of February 1st, 2021. So that leaves Quebec, Nova Scotia, New Brunswick, Newfoundland, and Labrador as our last provinces still practicing birth alerts. In 2019, MCFD released a statement that was to address the existence of birth alerts and the end of their practice. These are the major points that were discussed, and the statement by Katrine Conroy, who's the Minister of Children and Family Development, and this is her statement as follows. Effective immediately, British Columbia is ending the child welfare practice known as hospital or birth alerts. Used in hospitals for decades in BC and in other provinces and territories, these alerts are issued without the consent of the expectant parents where there is a potential safety risk to infants at birth. We are changing the way we work with and support high-risk expectant parents to keep newborns safe and families together through a collaborative rather than an involuntary model. Healthcare providers and social service workers will no longer share information about expectant parents without consent from those parents and will stop the practice of birth alerts immediately. We know that birth alerts have been primarily issued for marginalized women and disproportionately Indigenous women. We acknowledge the trauma women experience when they become aware that a birth alert has been issued. We also heard calls to end this practice from Indigenous communities, organizations, and the report from the National Inquiry into Missing and Murdered Indigenous Women and Girls. Moving to a voluntary approach of providing early supports and preventative services to expectant parents will help them plan and safely care for their babies. This change to practice allows for more trusting, collaborative relationships with service providers right from the beginning while empowering women, their families, and their communities to work together to care for their children. This step is consistent with my mandate from Premier John Horgan to provide better supports to keep Indigenous children at home and out of care. It responds directly to the recommendation from the National Inquiry into Missing and Murdered Indigenous Women and Girls to stop using birth alerts, and reflects our commitment to implementing the United Nations Declaration on the Rights of Indigenous Peoples and the Truth and Reconciliation Commission of Canada's calls to action. So that's the statement that MCFD released. And while it sounds that they attempt to take some accountability and have good intentions surrounding the end of birth alerts, I just want to plant some seeds and questions to consider while we go over the next couple slides. So how much do you think their practice has changed since 2019? And what do they mean exactly when they mention that they're moving to a voluntary approach? How voluntary do you think their approach may be, as opposed to being a level of force in certain instances? So now that we know a little bit more backstory about Canada's awful history with the child welfare system, let's get into some policy and legislation that would be applicable to or directly relate to birth alerts. I'd also like to note, while birth alerts do not solely affect Indigenous families, we know that they disproportionately do, and much of the policy that I'm going to discuss does emphasize Indigenous rights to child welfare on a federal level. So assuming that we're all quite familiar with Bill C-92 by now, we are going to discuss it anyway. So Bill C-92, an act respecting First Nations, Inuit, and Métis children, youth, and families, will finally enshrine into law what Indigenous peoples across Canada have asked of governments for decades: to affirm and recognize their jurisdiction over child and family services. So under Bill C-92, Indigenous communities and groups will be free to develop policies and laws based on their particular histories, cultures, and circumstances. They are free to move at their own pace to implement and enforce these policies and laws. And the purpose of the bill is to affirm the rights and jurisdiction of Indigenous peoples in relation to child and family services, and to set out principles applicable on a national level to the provision of child and family services in relation to Indigenous children. The second bill that I want to talk about is Bill C-15, which is the United Nations Declaration on the Rights of Indigenous Peoples Act. So as written, this bill would require that the action plan includes measures to address injustices, combat prejudice, and eliminate all forms of violence and discrimination against Indigenous peoples, including elders, youth, children, persons with disabilities, women, men, gender diverse, and two-spirit persons, to promote mutual respect and understanding, as well as good relations, including through human rights education. The UN describes it as setting an important standard for the treatment of Indigenous peoples that will act as a significant tool toward eliminating human rights violations against Indigenous people and assist in combating discrimination and marginalization. Following the discontinuation of birth alerts, BC introduced provincial policy regarding support services for expectant parents. The purpose of this protocol is to outline roles, responsibilities, and available services from MCFD or a delegated Aboriginal agency and the corresponding health authority. The protocol supports collaboration when providing support and preventative services for families with vulnerabilities and/or expectant parents. Family support service agreements include voluntary pre-birth planning, which would involve a social worker to make an effort to engage with expectant parents in a pre-birth plan. A social worker would explain to parents that their engagement is purely voluntary. Parents might be uninterested, but circumstances may change, which allow for their engagement in a helping relationship. If expectant parents make it clear that they do not want preventative or supportive services, a social worker is to take no further action. If parents are receptive to preventive and support services, a social worker should discuss with them the anticipated vulnerabilities and how vulnerabilities may be reduced. They should provide parents with information about preventive and support services that can assist them to mitigate risks. With a parent's consent, a social worker can offer to refer them to services, so that would encourage involvement of extended family and, where applicable, Indigenous or cultural community in supporting the parents to engage in voluntary support and prevention services. A social worker can offer the parents a collaborative planning meeting, and that would explore less disruptive measures and facilitate the development of a support plan that would keep the infant safely in the parent's care once born. So, post-birth period in the hospital. A social worker should explore all least disruptive measures to keep the parent and child safely together, including the possibility of parent and child residing with extended family members or another safe arrangement, such as services from public health or a doula. When a child is Indigenous, involve the infant's Indigenous community with the parent's consent unless there is an agreement with the child's Indigenous community under the CFCSA to involve the Indigenous community even without the parent's consent when developing less disruptive measures or when circumstances require disclosure without consent to ensure the safety or well-being of the child. So I also wanted to discuss information sharing with third parties prior to the birth. So a call regarding concerns about expectant parents that pertain to their yet-to-be-born child but does not pertain to any children currently in their care is not a child protection report and does not fall under sections 14 and 16 of the CFCSA. So such a call would be recorded in a memo that's screened, and it would be sent to a non-protection and voluntary response as a service request. So this type of service request may be received from third parties only for the purpose of reaching out to expectant parents to offer them preventive or support services in accordance with procedures relating to support services for expectant parents outlined in Policy 2.2. So when there is a need to share information with third parties, social workers do not disclose information without the expectant parent's consent. And disclosure of information to third parties without a parent's consent is not authorized under the CFCSA and is a violation of the parent's charter rights. So I actually had a bit of difficulty finding the use of birth alerts in other countries or other jurisdictions. And I kind of based that off of maybe the language we use and terminology. So I got a little bit creative. I made a post on Reddit explaining what birth alerts are in Canada, and basically just asking people if this is something that they practice where they live. So a social worker in South Carolina reached out to me and basically confirmed that they do practice these, but what they call them down there are be on the lookout letters. And so an agency would send a letter to a hospital detailing their concerns and whatnot. So I looked into a bit more and I asked that social worker if this was public knowledge. She said it wasn't. So I couldn't find anything with their policy. Did a little bit more digging and I found something in the UK called safeguarding. So in the UK, their current policies are a bit mixed in that if a practitioner determined any risk or concern for an unborn baby, they are to inform maternity services of their concerns. So this feels somewhat similar to the approach that we've been practicing. However, they also make a referral to address concerns beforehand that would minimize harm to the parent and child, which is what they refer to as safeguarding. So what are the 6 principles of safeguarding? So first introduced by the Department of Health in 2011, but now embedded in the CARE Act, these 6 principles apply to all health and care settings. So number 1, empowerment. People being supported and encouraged to make their own decisions and informed consent. Number 2, prevention. So it's better to take action before harm occurs, as we know. Number 3, proportionality. The least intrusive response appropriate to the risk presented. Number 4, protection. Support and representation for those in greatest need. Number 5, partnership. So local solutions through services working with their communities. Communities have a part to play in preventing, detecting, and reporting neglect and abuse. Number 6, accountability. So accountability and transparency in safeguarding practice. So what does safeguarding mean when it comes to unborn and newborn babies? So as I mentioned, if a practitioner determines any significant concerns or risks, They make a referral to children's social care if there are significant concerns for the safety of the unborn baby or any other children in the family. So a referral must be made at the earliest opportunity in order to provide sufficient time to make adequate plans for the baby's protection once born, provide sufficient time for a full and informed assessment of the needs, risks, and strengths to support the baby from birth. From my understanding, this involves the parents. Avoid initial approaches to parents in the last stages of pregnancy at what is already an emotionally charged time. The way I interpreted this is that they're not going to come into the hospital unannounced and apprehend your baby after you've just given birth. They want to avoid that, so they want to make contact as soon as possible. They enable parents to have more time to contribute their own ideas and solutions to concerns and increase the likelihood of a positive outcome for the baby. And they enable the early provision of support services so as to facilitate optimum home circumstances prior to the birth. So from what I gathered, this is similar to the approach that BC is now taking when considering pre-birth planning. So we're pretty much done our discussion of birth alerts. The next couple slides are just infographics that I obtained from the government website and MCFD. So basically just explains when offering or providing services, information can only be obtained and shared about a pregnant person with their written consent. With written consent of the pregnant person, an MCFD or DAA worker can make agreements or share info with other governing bodies and community agencies where necessary to integrate planning and or delivery of support services. So yeah, next couple of slides basically are just various situations of how MCFD or a DAA worker would handle expectant parents and mitigating risks.